Well, welcome everyone. I'm Gary Salmon. I'm the CEO and co-founder of Talon Security. I've been in the healthcare technology space since the early 90s. I've kind of grown up in this world, everything from DOS-based systems to Windows to cloud and cybersecurity. My first real introduction into the realities of cyber and the impact that a threat actor can place on an environment was in the early 2000s. I built out one of the very first healthcare-based cloud systems before we even knew what the word cloud was, right? We took some servers, we hooked them up to the internet, and because of the popularity of that system, we had thousands and thousands of users running our EHR system through it. And at one point, we realized, wow, we have millions of patient records in these systems. And if someone gains access to these systems, it could be a really bad day, right? And this was long before ransomware even existed. So we invested heavily in some state-of-the-art Cisco technology to try and detect intrusions, et cetera. And about 6 months after we implemented that solution, Cisco IDS, IPS triggered and basically locked out thousands of users, and it was an immediate train wreck. But the good news was the technology worked, right? There was an attempted attack on our environment. It was actually stopped. The intruder didn't get in. And that was really my first real big wake up call where I said, man, if this had gone in another direction or we hadn't invested in this technology 6 months ago, could have lost everything, right? Not to mention, millions of patient records being exposed. So ever since then, I've been basically obsessed with security and fighting the good fight against the bad actors. And we're going to fast forward to kind of today where we are. We formed Talon Security in 2017, and one of the things we really focused on was how do we prevent these events from occurring? Because we are not only a preventative company, we're also a full incident response company. So we've done hundreds of cyber events, ransomware, email intrusions, fraud, etc. And we know firsthand how these threat actors are actually breaking into these networks, right? Not the theoretical stuff, right? Not the articles that, vendors are pushing down your throat, but really what methodologies, what techniques, what are the TTPs that these threat actors are using to get a foothold into these environments? And then once they get into the environment, what are they actually doing to exploit? So one of the things we started to realize, back about 5 years ago was that once you start leveraging a lot of preventative services like vulnerability scanning and pen testing and training and a lot of these other, high worth items, we started to realize that small, medium, and even large organizations were really struggling with all of that data. And then more importantly, triangulating that data and analyzing it and not having to open up four screens to look at your MDR or XDR solution, your internal vulnerability data, your external vulnerability data, your training. You kind of get the idea. And then, especially for medium and large organizations, the data is so vast that it's unmanageable, right? You get a vulnerability scan report from a vendor and there's 500,000 vulnerabilities, or hundreds of thousands, or if you're a really large organization, millions of vulnerabilities. And then what happens in most organizations? They're like, yeah, I don't even know what to do with this. And unfortunately, the file gets closed and no one seems to address it because you just can't. You can't manage that quantity of data. So about 5 years ago, we were starting to deal with this exact situation with a lot of our medium to enterprise level healthcare clients where we would present all this amazing data and the CIO or the CTO or the director of IT be like, hey, guys, thanks for all of this amazing information. I don't even know where to start. So we started to work with a lot of our larger clients, and we started to really understand what type of data do they need, how do they want to look at it, how do they want to access it, and then how do they action on it. And that started the evolution of what you're looking at today, which is called EAGLEi, which is basically a data visualization tool that takes a lot of telemetry from your environment, from your vulnerability scanners, from your training platforms, right? Most of this we're providing just for full disclosure, and then presenting it back to you in a very actionable way. And then about 6 months ago, we had this idea and we're like, okay, we have all of this telemetry being fed in, we're doing these nice graphs and charts, but can we now convert all of this information into a cyber risk rating? So anyone that's responsible for security, from like a level two help desk individual to network engineer to a security engineer to CTO, CIO, CEO, all the way up to, say, a board, can they get this cyber risk rating and know within, seconds to minutes exactly where they have risk? And the answer is yes, right? And that's one of the things that is so attractive to this platform, is that you can take all of this data, hundreds of thousands or millions of data points, and within seconds see how you stand from a cyber risk score. And we'll dig into this in a little bit more detail in a couple of minutes. So a little backstory on us. We secure about 1,900 healthcare entities across the United States. We have about 55,000 assets under management. Last year in 2025, excuse me, I misspoke. In 2024, we detected about 5.5 million vulnerabilities across our clients' environment. And Steve mentioned this a little bit earlier about remediating vulnerabilities. And it is a major challenge within the healthcare space and, frankly, almost any vertical. You identify all these problems with your endpoints, but how do you actually fix them? So one of the things that really makes us unique is we do have the ability to do autonomous remediation and patching, right? And as many of you know, this is a huge problem, right? You identify a vulnerability, then your technicians have to run around kind of with their heads cut off, trying to figure out, how do I patch this thing? What do I need to do? Did the patch even work? How many endpoints are impacted? You get the idea. So the cool thing is we pushed over 2 million patches in 2024 alone, without bringing down a single machine. So, and the amount of risk that we reduced for our clients was about 70% through this amazing platform. We stopped, through our MDR solution, about 580 active attacks. And we identified over 91,000 external vulnerabilities kind of just facing the world, right? Those internet facing vulnerabilities on your servers, your modems, your firewalls, things like that. So we'll talk a little bit more about attack surface analysis in a few minutes. So one of the things that I always say, and I challenge everyone who has a role or responsibility in security, is to challenge yourselves, right? And I always say, Michelle, Dave, as the CISO, as a CTO, as a CIO, director of IT, what keeps you up at night, right? And usually the response is a laugh, and it's either everything or the people, right? Or my blind spots, like things I just don't even know about, rogue devices, shadow IT, right? Misconfigurations on firewalls, like all these things are how hackers, gain access into your environment, right? And because we've done so many forensics investigations, I can tell you that around 60% of cyber attacks are through social engineering, right? Everyone on this call understands social engineering: phishing, spear phishing, vishing, smishing. You get the idea, right? And often that those attacks are the result of untrained individuals. And a lot of organizations say, "Oh, well, we do cybersecurity awareness training and we do simulated phishing." And I'm like, okay, that's great. What percentage of our people are trained right now? If I came to you and said, hey, out of our 500 employees, what percentage or what number are fully trained? Could you answer that question? What's their average passing score? Who's clicking on, malicious links, attachments, etc.? These are all KPIs and data points that you should have at your fingertips, right? And you can use these KPIs to roll up to a cyber risk score. So around, high 30-ish% of attacks are also through vulnerability exploitation. Hacker scanning your environment, hacker scanning your external facing devices, finding vulnerabilities, finding human mistakes. Someone opened a port, someone forgot to apply the latest patch of the software to the firewall, an out-of-date device, a known exploitable vulnerability, exposed interfaces, right? These are all very high risk vulnerabilities that if you are not hitting your external facing environment every day to have a clear picture of your external attack surface, unfortunately, there's a high likelihood you will have an event. And sometimes these events are just human error, right? A technician opens a port because a vendor or a supplier needs to log into your environment, or ports open because there's a piece of technology that needs it open, and no one's assessing the risk associated with doing that. And that's what this platform does for you. So one of the key things that I always say is security has to be driven through data analysis and KPIs, period. Right? I feel like so many healthcare organizations do well, we feel like we're doing a good job. We know we're doing a good job. We have the latest tier one EDR, XDR solution like CrowdStrike, SentinelOne, so I'm sure we're fine. We had a pen test done. Oh, when was that done? Oh, it was done like 2 years ago. So you get the idea here. So we have to move away from feelings and start moving towards real data, right? How are we today from a security risk perspective? How were we a month ago, 6 months ago, 12 months ago? And, how can we kind of project where we're going forward? And, through EAGLEi, you're going to have all of that data at your fingertips. So if the CEO of your hospital comes up to you and is like, hey, how are we doing from a security perspective? I got to present to the board or compliance or regulatory body. Where are we? How amazing would it be if you could instantly say, no problem, give me 2 minutes and I'll give you all of that data and you can drop it right into your PowerPoint, right? And how does data help you make better decisions? So for hospitals, most hospitals make, purchasing business decisions, investments on data, right? And we need to do the same thing from a security perspective. So innovation, right? That's one of the things that we're really leading the charge. And Steve, I know you had, chatted with us many times and gone through this product. And one of the things you always said was, hey, it looks like you guys have really figured out the secret sauce here, right? The ability to identify risk, manage risk, and eliminate risk, right? So what EAGLEi does is it really helps you paint your internal and external attack surface, understand your risk, understand where you have blind spots, but most importantly, using actionable information and KPIs to do that. And one of the things that we also have to do is evolve, right? And that's one of the biggest mistakes I'm seeing in the healthcare space right now is there is no evolution, right? There are network defenders that are literally doing the same thing they did 2 or 3 years ago and expecting not to have a bad outcome, immediately or in the near future, right? So being able to stay on top of the latest trends and technology and threats and leveraging that information inside of our EAGLEi platform to better assess risk for your organization is extremely powerful. So EAGLEi also provides transparency. So some hospitals and healthcare orgs have internal IT, some have 100% external IT. I find many have a hybrid. And one of the challenges that I often see is that because you have an external source managing your cyber risk, you actually don't know where you have risk, right? Maybe you get some reports, maybe you have a conversation or a meeting or an assessment, once a year, but that is just a shot in time, or as we call it, a single point of time. And, the data you had 5 days ago, may or may not be relevant today. So through EAGLEi, you have transparency. All key parties associated with security can identify and react to risk, period. Right. And then there's clear data and KPIs. So all network defenders, internal and or external, can focus on the areas, right, that you need to focus on that have the most meaningful impact. I find what often happens is network defenders don't know where to start, and there's a tremendous amount of money and resources spent on minimizing risk where risk didn't really need to be minimized because there wasn't actionable information. Cyber resilience, right? In the end, that's what you're trying to build for your organization. How do I identify the risk? How do I risk rank the risk? How do I proactively address it? How can I leverage my cyber risk score to increase resources, decrease resources, reallocate resources, and put them in the place that will provide the best results? A lot of times organizations will say, well, that's our biggest risk over there on the west side of the building and in that, area of the hospital. and they're going to focus all of their attention defending that. And the hackers come in and they burn you down on the east side, right? Because you don't have any visibility into that actual risk. And then tracking resilience over time. Now, God forbid you have a cyber event. One of the things that the Office of Civil Rights will do is they'll say, hey, show us evidence that you were on top of this. How are you reducing risk for your hospital? And EAGLEi tracks all of that. You can see your cyber resilience increase or decrease, hopefully decrease over time. And that's a very powerful message that can be delivered to OCR, where you can say, hey, here's where we were on day one when we started with our cyber resilience platform. Here's where we are 9 months, 12 months later. We've reduced risk by 63.2%. Right? What type of investigator wouldn't say, okay, you guys are trying really hard. This is impressive. Versus you coming back and potentially saying, yeah, I don't have any historical data. I don't know where we were 2 months ago. Right? Or, oh, here's our vulnerability scan from 6 months or a year ago, or a pen test from 18 months ago. Right? Investigators don't want to see that. So really what the goal of this platform and Black Talon and Steve is to keep you operational. We understand clearly how a cyber event in your organization is in fact so detrimental to your operations. And one of the things I always say is you can't measure cyber risk. If you don't know your cyber risk. If I said that to you right now, where are all your cyber blind spots and what is your risk? Could you answer this question using real-time data and analytics, right? This is the kind of like gut check that every cyber defender or anyone responsible for cybersecurity within an organization has to be able to sit back and say to themselves, do I really know where my blind spots are? Do I understand my risk? If an executive team member came to me or I needed to answer up the chain to the board or investors or regulators, do I have an answer right now? These are some of our core services, and then we're going to jump into EAGLEi. So we like to break our technologies and solutions down into defensive and offensive strategies. I think this is going to be very obvious to most of you on the call, right? We are SentinelOne shop. We are actually working on bringing CrowdStrike data in. So if you are a CrowdStrike CrowdStrike shop, we are working on bringing your data in. We do leverage AI-based email security to look at your emails, analyze them. I am definitely seeing more intrusions into email systems than ransomware executions right now. We do offer 24/7, 365 MDR, so we can become your SOC. We do malware analysis, email analysis. But I think this is all very obvious, and a lot of organizations are doing this well now. Where I see the problem is offensive strategies, right? Running these daily external vulnerability scans and port scanning and unauthenticated and authenticated internal vulnerability scans, painting this attack surface analysis picture so you have clear visibility into your internal and external risk. Biannual pen testing for almost all of our healthcare clients. We are now doing biannual pen testing. As you know, Health and Human Services has it in their proposal for all organizations to do vulnerability scanning and pen testing. Security assessments, we have a full cybersecurity awareness training platform, so you don't have to outsource that. Password management tools, I think many of you get the idea here. So we are a full cyber shop. So let's take a look at the window into cyber resilience through EAGLEi. So EAGLEi is a true cyber resilience and risk analytics platform. It's based on KPIs, the attack surface analysis, the training academy, benchmarking. I have not mentioned this. This is something that was in very high demand. And I know when Steve saw it, he was like, whoa, that's awesome. Being able to benchmark your organization against approximately 2,000 other healthcare organizations is extremely powerful. You can see on average, are you above other Black Talon Security healthcare clients, or are you below other Black Talon Security clients from a risk perspective? And this is always a good gut check, because if you're way below, you're like, hey, the things we're doing are really working well. If you're above the average, the benchmark, there's probably some problems within the organization. And then once again, the platform helps you identify those and address them. Right. And going back to my last statement, this does really help drive HIPAA compliance and risk mitigation. So This is, in fact, the dashboard. We spent a tremendous amount of energy and resources and investments bringing this technology to our clients. This is, in fact, V3, and the platform has been around for 5 years. And just a little bit of background on it. This is 100% built on Salesforce.com. We leverage CRMA, which is also known as Tableau, and we're doing a tremendous amount of data analytics and calculations in the background. So kind of starting in the top left-hand corner, the vulnerabilities, that 60,000 is indicating the open critical vulnerabilities, not the total number of vulnerabilities, because we all know some vulnerabilities are low risk, others are very high risk. So in this case, you are seeing about 60,000 vulnerabilities. It's also telling you how well either Black Talon has resolved the critical vulnerabilities, or if you opt to address this yourself, how many vulnerabilities your network defenders have addressed. In this case, about 10,300 vulnerabilities. And unfortunately, how many new critical vulnerabilities appear in your environment, because this is a cat and mouse game. Your team or Black Talon does a great job at mitigating these vulnerabilities, and boom, the next scans hit, and guess what? There's a whole bunch of new vulnerabilities. Your cyber risk rating, right? This is one of the most powerful components of what we do. If you have multiple departments, or you have multiple locations, or you have a hospital and you have physicians' offices kind of spread out around your communities, you can break all of this data down to, your ER, to your first floor, to your second floor, OR, etc., and look at the cyber risk ratings for each of those locations, or you can look at them globally for your organization. So each of those areas could get a unique cyber rating, and then it rolls up to your overall org. So in this case, we score 11 for this organization, or I should say this organization scores an 11. Our risk rating goes from 1 to 100. The lower the number, the less risk you have. The higher the number, the higher risk. And it is calculating a lot of pieces of telemetry. What's the risk of the vulnerability? How long has it been in your environment? Is it internet facing? Is it known exploitable? Is it an open port? You get the idea. All right. So that is an evolving number. In the right-hand corner, if you are leveraging SentinelOne with us, we will track the number of threats we detect, stop, kill, network quarantine, all the fun terms in the cyberspace, so you'll have true visibility over time on that. In the middle, that is going to be your cybersecurity risk rating over time. So you can kind of see, how am I doing? Like, is my cyber risk increasing month over month? Is it decreasing? Is it ebbing and flowing, which is often normal? And how do I compare to other healthcare organizations? So that other line, you see kind of that solid pink line, that's you. That dotted line right above it, that is going to be the benchmarking from 2,000 other healthcare organizations. So in this case, this is all real data, by the way. We just anonymized it. This healthcare organization is basically following the trend of 2,000 other healthcare organizations. Okay. Moving down to the gauges, external devices with vulnerabilities. Depending on the size of your hospital, you might have 1, 2 firewalls. You could have hundreds. So what we're doing is we are showing you that 3% of your external facing assets have some type of vulnerability. In this case, this is a large healthcare organization with almost 900 external facing devices, 899 to be exact. How many actual vulnerabilities do you have across those 899 devices? In this case, there are 68. What's your external exposure? Right. So do I have exposed services? Do I have open ports? Well, in this case, yeah, you do. You have 131. So this is actually being pulled daily. And the reason we do this is because we often, through forensics, see a correlation between a port being open or a vulnerability on the firewall and a cyber event. Hackers can scan the internet, obviously millions of times every day. Or millions of devices every day, I should say. Sorry, reverse that. And if you have these open or exposures on your firewall, your internet-facing devices, they will find them, right? I see a lot of ransomware attacks where there was a firewall that wasn't patched properly. These open ports, exposed services. security through obscurity, the hackers will find all of them. The Black Talon Academy, if you opt to leverage our training platform for HIPAA and cybersecurity awareness, the data will be presented right there. Asset inventory. This is another powerful feature. It gives you the ability to see every single asset. Now, we are strictly talking endpoints for full disclosure. So Windows, Mac, Linux, Unix computer. This is not going to be an IoT device like a smart TV or a printer. That is a separate report that you would get from us if you leverage us for that. So what it's showing us is, how many endpoints we are tracking. So for this healthcare org, we are tracking 4,564. It is not a secret. We leverage Qualys as our authenticated vulnerability agent that sits on every single endpoint. In this case, between SentinelOne and CrowdStrike, I misspoke. SentinelOne and Qualys, you can get a very good indicator as to how many agents are deployed on each of those devices. Also understand that sometimes the numbers may be a little off because endpoints are turned off for whatever reason. They're being decommissioned, and sometimes that data takes a day or up to a month to repopulate the number, right? Because if an endpoint doesn't check in, within 24 hours, we're not going to pull them out of asset inventory. We're going to wait over a period of time to see, hey, maybe that's just been decommissioned and the IT resources forgot to pull it out. Then you have the endpoint name. The account name can also be associated with like a physical location, facility, building. And then what's their cyber risk score, which is really kind of like an exposure score. And then the severity of the vulnerability. We score our vulnerabilities on a scale of 1 to 5, 1 being low risk, 5 being high. And then we give you some information. What's the Qualys version? What's the SentinelOne version? What's the OS on that endpoint? So a tremendous amount of really powerful data right at your fingertips. And in the top left is just taking a look at your exposure score over time, right? There's a little pop from October to November, some slight trending upward in February, some downward trending, a tiny bit of upward trending. So the typical ebb and flow of the cyber world. Well, what are we looking at now? What we're looking at now is internal vulnerabilities, right? So with internal vulnerabilities, we are going to grab your vulnerability data every 4 hours. And that data is available to all of our network defenders internal to Black Talon. And then we're typically exposing this data back to you either daily, weekly, bi-weekly, or monthly. That is an option that you would be able to select on your onboarding in terms of how often you want your data refreshed. You can also, let's just say you opt for monthly data refreshes of all your internal vulnerabilities, and your network defenders just spent the whole night crushing vulnerabilities and you want an updated report. You just click on update internal vulnerabilities, and within a couple hours, you'll have a full refresh of your data set. So what you're looking at here now is basically every single known and detected vulnerability in your environment. We offer extremely powerful filtering and searching capabilities. So you want to search by vulnerability or cyber risk exposure score, how many endpoints are impacted. You get the idea. You'd be able to filter that down to the point where, like, hey, if you have 1,000 computers, you may be able to instantly find the 5 machines that have that risk. But I'm also going to show you another way of doing that. So if you want to take a look at vulnerability details, in this case, I clicked on the prior screen, the end of life obsolete software, Microsoft.NET version 6 detected. When I click on that, boom, it returns a list of every single endpoint that has that known vulnerability. So if your network defenders are needing to address this vulnerability, they instantly know which endpoints are impacted and can drive the patch or the remediation directly to the impacted machines. The next is the details on the vulnerability. So what happens a lot of times is these vulnerability scans tell you have a problem, and they may not often provide a good solution. So the second your network defender clicks on that little eye with a circle in the top left-hand corner here, right? The second they click on that, the the pop-up box will appear in the top right-hand corner, and it's going to show you what the solution is, what the impact is, and what the threat is. And what that does is that significantly reduces the amount of time and energy your network defenders have to invest to address the cyber risk. All right, so now we're into threats. As I alluded to before, if you are leveraging SentinelOne with us, we give you full transparency into what we're detecting, what we're stopping, average time to mitigate, was it marked benign, things like that. So really powerful data. And the other nice thing is you can start looking at this data by machine, by physical location, by operating system type, right? So you can start identifying things in your environment that are causing most of the problems. We know for a fact that sometimes either users or an endpoint have a higher frequency of malicious code for various reasons, right? Because someone is constantly doing just bad things on that endpoint, trying to install software, download things, visiting bad websites. So this gives you very clear visibility into some of those behaviors as well. This is your threat detail. So if you click on something that we killed or marked benign, you have clear visibility into what it was, the name of the threat, the device that it was on, the path of the malware that we killed, etc. Right. So once again, transparency between all parties is so important. All right, this is external vulnerabilities. So if I said to you now, could you identify every single external vulnerability across your environment? Hopefully the answer is yes, but what I find for most healthcare organizations and hospitals, the answer is a smile, a laugh, and I wish I could. Here's something very unique that we do. We leverage the authenticated vulnerability agent that sits on every single endpoint to feed EAGLEi the external facing IP address. So whether that's in a hospital, at one of the physician's offices, or Mary from revenue cycle management sitting at her home logging in, we will grab all of those IPs, feed them into EAGLEi, and then depending on your cadence, run vulnerability scans daily, weekly, bi-weekly, or monthly. And we will run daily port scans on those IPs. So even IPs that you're not even tracking or are aware of, we are doing that for you, right? It goes back to, where is my house going to get burned down? It's going to get burned down in the areas that you have no visibility into. And I will tell you, CISOs, CTOs, CIOs, right? They love this, right? This is one of the most powerful features because we're giving them a picture into their risk that they absolutely didn't have prior to this, right? So here are all of your external facing vulnerabilities. You can look at these by severity rating, by score, the number of detections that we're finding across your environment. And then you can also look at it by physical location, right? Or facility. And then obviously, like anything else, you have graphing and KPIs and data, and how do these vulnerabilities impact your overall cyber risk rating. So all of that data is right in front of you at your fingertips. And if you're not sure of the first vulnerability, your secure socket layer, transport layer issue, you hit that little eye with a circle to the right of that. It's going to tell you exactly what the problem is. This is external services. So these are typically exposed services. It could be an open port. Unfortunately, what we're seeing all too often is someone has exposed the firewall console to the internet. And the second you do that, I think most people either know or don't know or understand the risk associated with that, but you're basically giving a threat actor a whole bunch of information in order for them to execute an attack against you. So being able to identify all of these exposed services is extremely important and very powerful, and this is gathered on a daily basis. We saw a ransomware attack against a healthcare group about 2 months ago where a very seasoned internal IT resource spun up an RDP server and somehow managed to expose RDP to the internet. And within 24 hours, that server was hit. And when I talked to the CISO, who I've actually known for years and isn't leveraging our platform, he immediately said, I know, you've warned me about this. And we had all these SOPs and we had the tier one EDR solution, and they still beat it. And he's like, I realize now I have no external attack surface management, or I've limited based on, my quarterly scan. So having this clear attack surface analysis is extremely powerful. Black Talon Academy, this is our enterprise level cybersecurity awareness training platform that most of our clients do leverage with us. It is healthcare specific. So this is not going to be general business training that you get from a lot of other platforms. It's going to talk about patients, and x-rays and MRIs and protecting patient data, and making it really relative. And the trainees, the doctors, the team members, right? They can understand it and they connect with it, versus, talking about, oh, so if your, customer, places an order with you or sends you this email and you're like, we don't have customers, we have patients, right? So all of this data that is gathered from our training platform, which is based off of micro training modules, all this data rolls up into EAGLEi. So as someone who's in charge of cybersecurity awareness training, whether that falls under the technical side of the house or the HR and compliance, those individuals have this data at their fingertips, so they can see how many people are enrolled, how many people have trained, how many people have started but haven't finished, and then unfortunately, who's failed, right? So you have all of that there. And also from a compliance and regulatory perspective, if you're ever audited and they're like, hey, we need to know, who's been trained in your organization. This data is all easily attainable, or attained, I should say, from this platform. So this just gives you a little bit better idea. These are the employees. Obviously, I've blocked out this information, but these are the people who have trained and passed, what their scores on the exam, how much time did they spend, right? Because a lot of times executive teams will say, well, how much time is each of our employees spending on this training? And you can now tell them easily. All right, so I want to go ahead and wrap up here, and I want to see if anyone has any questions. If not, Steve, love to hear if you have any feedback or thoughts.
How long does it, if somebody's interested, how long does it take to get started with Black Talon?
Yeah. So we can provide the installation tools within about 24 hours. It does, in this case, it does have a lot to do with the size of your organization and how you want to segregate the data. If you're a smaller hospital with a relatively flat environment, you can be up and running in a couple of days. It's that simple. If you are a larger healthcare org or hospital and you want to take all this data and put it into the different buckets, by department, by facility, by physician's office or group, we would need to gather some of that data for you. And then what we actually do is we provide unique installers coded to each of those locations or facilities. So when you look at EAGLEi, the data is coming in correctly, and you'll be able to see like location 1, 2, 3, 4, 5, or OR, waiting room, ER, first floor, second floor, third floor, whatever it is. Once the agents are deployed, we will typically have a full attack surface picture of your internal endpoints as well as your external facing environment within about 48 hours, sometimes less. So the data does come in very, very quickly. So it's a very simple deployment. Any type of RMM tool or software deployment tool can be used to push our agents.
Okay, great. What kind of information, Gary, do customers need to provide to us to get a better understanding of what the costs would be? I mean, do they just need to kind of tell you, like you just said, if you've got a small, flat organization, do they just need to give you, number of workstations that we're going to monitor? Or maybe you can discuss that a little bit.
It's actually pretty much that simple, Steve. Most of what we do is by endpoint. So we also understand that hospitals do have some of their own technology that may be overlapping with us. So we can do a la carte. So, for argument's sake, if you're just looking for attack surface management and vulnerability management, you could buy that. We need to know the number of endpoints. If you want to leverage the attack surface plus autonomous remediation, no problem. We can add that feature on with the flip of a switch. If you want us to become your MDR shop for SentinelOne, do that too. So I think it really starts with a scoping call, and kind of understanding what the goals are of the hospital or the healthcare organization, getting a picture of what the environment looks like in terms of topography, network topography, and size, and then we'd be able to scope it out pretty easily. So
Gary, thank you very, very much.
you're very welcome. Thanks, Steve, as always.
Have a great day, everyone.